Hello, my name is Whitney Henry, and I'm a nursing student in the Indiana State University LPN to BSN nursing program. This is my presentation on sudden infant death syndrome, also known as SIDS, and infant sleep safety. The target audience for this presentation would be parents or guardians, as well as caregivers of infants. The learning objectives for this presentation is that upon completion of this presentation, my viewers will be able to state the definition of SIDS, explain who is at risk for SIDS, identify maternal, environmental, and infant risk factors, and discuss the actions that can be taken to improve infant sleep safety and prevent SIDS. Please pause here and take the PreTest, which is located underneath the video in the form of a link. This will allow you to assess your current knowledge on SIDS and infant sleep safety, as well as assess your improvement in knowledge throughout the course. Let us first discuss what sudden infant death syndrome is and who it affects. Sudden infant death syndrome, or crib death, affects approximately 1 out of every 1,000 infants between the age of 1 month to 1 year old. It usually occurs in infants who seem otherwise healthy, and it occurs during their sleep. Although we don't know a certain cause of sudden infant death syndrome, and it can be accumulation of many things, it is thought that a cause could be a defect in the portion of the infant's brain that controls deep sleep, arousal from sleep, and breathing. Although we don't know a certain cause of sudden infant death syndrome, there are several measures that we can take to prevent SIDS and promote sleep safety in infants. There are predisposing factors that put an infant at a higher risk for sudden infant death syndrome. There are infant risk factors and maternal risk factors. It is important to note that there is such a thing as modifiable and non-modifiable risk factors. Modifiable risk factors are related to choices that we make that we can change to reduce the risk for sudden infant death syndrome. Non-modifiable risk factors are more like circumstances that we do not have control over and cannot be changed. For example, let's look at the maternal risk factor list. Maternal risk factors that put infants at a higher risk for sudden infant death syndrome include cigarette use or tobacco use, illicit drug use, alcohol use, poor prenatal care, which could include not taking prenatal vitamins, not seeing a provider, not being monitored. All of those that I have just listed are modifiable risk factors. That's something that the mother can change that would put the infant at a lower risk for SIDS. Another maternal risk factor that is non-modifiable would be the age of the mother. If a mother is under the age of 20, that infant is at higher risk for SIDS. Infant risk factors include prematurity and low birth weight, which usually go hand in hand, and mothers who are under the age of 20 are more likely to have premature babies. That's why that kind of ties in. The sex of the baby, boys are more likely to be at risk for sudden infant death syndrome. A family history of a sibling who has died of sudden infant death syndrome would increase the risk. Exposure to secondhand smoke, race, non-white, non-Hispanic infants are at a higher risk. This can be related to a lot of things such as access to prenatal care. And then also an infant who has recently had a respiratory infection is at a much higher risk for sudden infant death syndrome. There are also environmental factors that put an infant at a higher risk for SIDS. If you recall, we believe that SIDS can be caused by a defect in the portion of the baby's brain that is in control of sleep, sleep arousal, and breathing. So a lot of these environmental factors have to do with that, making sure that the baby has enough oxygen while they're sleeping and are able to be easily aroused. So keep that in mind as we go through these environmental risk factors. Side sleeping and stomach sleeping place a baby at a higher risk for SIDS. This has to do with their faces are more likely to be pointed down into the mattress, which decreases their ability to oxygenate. Also, sleeping on soft, non-breathable surfaces. There are many safe sleep mattresses out there that are specifically breathable, so if baby turns over and they're breathing directly into them, that they can get enough oxygenation. So sleeping on a soft, non-breathable surface is going to put them at a higher risk. Same with bed sharing. If an infant is in the adult bed with their parents or guardians, they are at a higher risk for breathing issues during sleep. Overheating, an infant who is overheated if the room is too warm or they're bundled up too tightly, there can be problems with arousal related to that. Items in the crib that are soft and non-breathable can also cause problems with sudden infant death syndrome, sleep arousal, not enough oxygenation. So those would be our environmental risk factors that put an infant at a higher risk for sudden infant death syndrome. Now that we've discussed infant, maternal, and environmental risk factors, let's take those risk factors and discuss how we can take action measures to improve sleep safety and prevent sudden infant death syndrome. Back sleeping is going to be the safest position for your baby to sleep in. Placing them on the back with their face up is going to give them the best option to oxygenate themselves during sleep. We want to immunize our babies on a schedule with our pediatric providers. This can help prevent those respiratory tract infections that can place the baby at a higher risk for SIDS. Pacifiers and breastfeeding kind of go hand in hand. It's about that innate suckling. And having a pacifier, for example, in the baby's mouth as they sleep will keep them suckling, will keep them breathing. We do not encourage bed sharing under any circumstances. That can be a controversial topic. Many parents, especially different cultures, enjoy bed sharing. If you do choose to bed share, it is highly discouraged that there is any kind of substance use, including alcohol, tobacco. Keeping your mind as sharp as possible when you're sleeping with your baby is going to give them the best chance at a reduced risk for SIDS. The best place for your infant to sleep would be in the same room as the parent or guardian, but on a separate sleep space. So this would be, for example, a bedside bassinet with a safe sleep mattress. We want to keep their crib or sleep space free of extra things. No crib bumpers, no stuffies, no cute blankets, nothing that could obstruct their ability to breathe or overheat them. It should just be the baby and the mattress. We want to prevent overheating, so make sure that room is regulated in temperature, and let's not bundle up those babies with too many layers. And then last but not least, one of the best things that can be done to prevent sudden infant death syndrome is reducing the maternal risk factors during pregnancy. Not using drugs, tobacco, or alcohol during the pregnancy, getting proper prenatal care. That is going to put the infant at a better chance and a lower risk for sudden infant death syndrome. Please pause here and take the post test, which can be located underneath the video in the form of a link. This will allow you to assess your now current knowledge of SIDS and infant sleep safety and how you've improved in your knowledge throughout the course. This is a brochure that I have created with other resources that inform parents, caregivers, and guardians about infant sleep safety and prevention of sudden infant death syndrome. If you'd like to access these resources, please locate the link underneath the video and print the brochure. The following are the references that I used to create this presentation. Thank you for watching this presentation on sudden infant death syndrome and sleep safety. It is so important that we equip caregivers, parents, and guardians on how to lower the risk for sudden infant death syndrome. I hope that you learned something that you can use to keep your baby safe.